Cardiovascular Health Introduction. Cardiovascular disease (CVDs) are a leading cause of morbidity and mortality worldwide, with significant variation in risk factors, disease presentation, and outcomes between males and females. These differences are influenced by a complex interplay of hormonal dynamics, lifestyle behavior, and genetic predispositions. For example, the protective effects of estrogen in premenopausal women are well documented, but disadvantages diminish with age and hormonal change, such as menopause. Conversely, men tend to experience cardiovascular events earlier in life, partly due to differences in risk profiles and biological factors. Furthermore, lifestyle factors, including diet, physical activities, and smoking, interact with this biological influence, while genetic predisposition shape individual susceptibility. Understanding how these factors contribute to gender-specific disparities in cardiovascular health is critical for developing target prevention, diagnosis, and treatment strategies. This paper explores the role of hormonal, lifestyle, and genetic influence on cardiovascular differences between males and females, highlighting their contribution to variation in disease outcome.
So here I want to explain about hormonal influences. The first one is estrogen in female. Estrogen has protective cardiovascular effect, including promoting vasodilation, improving lipids profile, and reducing inflammation. During menopause, estrogen level declines, leading to increased cardiovascular risk, such as higher blood pressure, worsened lipid profiles, and accelerate atherosclerosis. Hormonal fluctuation during menstrual cycle or pregnancy can also influence cardiovascular dynamics, sometimes leading to condition peripartum cardiomyopathy or preeclampsia. The second one is testosterone in males. Testosterone may contribute to higher blood pressure and unfavorable lipids profile in men, though its role is more complex and context dependent. Higher testosterone levels are linked to increased risk of atherosclerosis in some men, particularly those with underlying risk factors.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Hafizuddin bin Zaki. So today I'm going to talk about lifestyle factor. First, for smoking and alcohol use. Men historically have higher rates of smoking, a significant cardiovascular risk factor. However, smoking is very increasingly prevalent among women in some regions, narrowing this gender gap. Alcohol consumption patterns also differ, with excessive alcohol use posing a greater cardiovascular risk in men, but potentially affecting women more adversely at lower level due to metabolic difference. Secondly, about psychosocial stress. So what is psychosocial stress? Women are more prone to psychosocial stress and depression, which can increase their risk of conditions like Takotsubo cardiomyopathy. That means stress include cardiomyopathy. Men often experience stress related to occupational demands, contributing to the hypertension and CAD. Diet and physical activity. Third factor is diet and physical activity. Men are more likely to have diet high in saturated fats and cholesterol, contributing to increased coronary artery disease, which is CAD risk. Women tend to engage more in health-seeking behavior, including healthier eating pattern and higher participation in physical activity. Thought the socio-economic factor can alter this trend. So that's all. Assalamualaikum.
So I will explain about the genetic
predisposition. First, sex-specific genetic variants. Certain genetic polymorphism may have differential effects on men and women due to their interaction with sex hormones. For instance, genes related to lipid metabolism or blood clotting factors might exhibit sex-specific effects. Second, family history. A family history of early onset cardiovascular disease, CVD, often has a stronger predictive value for males. However, females with a similar history may also face heightened risk, particularly after menopause. Next, differences in disease presentation. First, acute coronary syndrome (ACS). Men typically present with classic symptoms like chest pain or pressure, while women often experience atypical symptoms such as fatigue, nausea, and shortness of breath, which can delay diagnosis. Second, heart failure. Women are more likely to develop heart failure with reserved ejection fraction, whereas men more commonly develop heart failure with reduced ejection fraction. Third, microvascular dysfunction. Women are more prone to microvascular disease characterized by poor perfusion despite patent large coronary arteries, leading to angina-like symptoms.
Impact on cardiovascular health. Prognosis. Women generally have worse outcomes after myocardial infarction or heart failure, partly due to delayed diagnosis, under treatment, and biological difference. Response to treatment. Men and women may respond differently to certain medication, such as statin or antiplatelet agent, necessitating personalized treatment approach.
So, the conclusion for cardiovascular health is the interaction of hormonal, lifestyle, and genetic factors creates distinct cardiovascular health profiles in males and females. Understanding these differences is crucial for improving diagnostic accuracy, tailoring preventive strategies, and optimizing treatments to reduce the gender gap in cardiovascular outcome.